I'll be speaking about the right to bodily integrity and the concept of sexual harm. My perspective on these issues comes from my background working in the science and ethics of what you might call non-therapeutic, non-consensual childhood genital cutting, alteration, surgery. I'm qualifying my terms here because, of course, the terminology in these areas is very contentious. Normally, you encounter three separate ethical discourses, one concerning the non-therapeutic alteration of female genitalia, another concerning intersex children, and finally another concerning male children. These are the terms you might be more familiar with seeing, so-called female genital mutilation, that's the World Health Organization's term, intersex genital normalization surgeries, and male circumcision. The relevance of these to the present topic is that opponents of these practices often argue that they are sexually harmful and that they violate a child's right to bodily integrity. So I want to try to explore what that might mean. Now, in the popular discourse, the male and female end of the spectrum is usually kept as far apart as possible. Often, if any suggestion is made that there might be a comparison, whether anatomically or ethically or symbolically or on other grounds, this is often seen as very problematic or objectionable. In the scholarly literature, you do see some exceptions to this. So this is a notable paper by the anthropologist Kirsten Bell. She floats some of these comparisons in her university lectures. This is Kirsten Bell here. And when she does, her students respond in this way. How dare I mention these two entirely different operations in the same breath? How dare I compare the innocuous and beneficial removal of the foreskin with the extreme mutilations enacted against females in other societies? Well, fortunately for Kirsten, she's not entirely alone. This is another anthropologist, Zachary Andrus, who is a specialist in genital altering rites and rituals across a large range of societies. And as his research has shown, the attitude that male circumcision is harmless is consistent with Western cultural values and practices, while any such procedures performed on girls are totally alien to Western cultural values. However, the fact of the matter is that what's done to some girls in some cultures is worse than what's done to some boys, and what's done to some boys in some cultures is worse than what's done to some girls. By collapsing all of the many different types of procedures performed into a single set for each sex, categories are created that do not accurately describe any situation that actually occurs anywhere in the world. It might be hard to understand what he's saying in abstract terms, so what I'd like to do is show you this chart. This is based on the World Health Organization typology for female genital mutilation. Here it's described as FGC for female genital cutting, as well as a preliminary typology of male genital cutting that's been proposed by some authors. I'll start at the bottom end of the scale. This is the least invasive form of genital cutting recognized as a form of mutilation by the World Health Organization, sometimes referred to as pricking or nicking, usually of the clitoral hood, which is the foreskin of the clitoris. In the United States in 2010, this was in fact proposed as a harm reduction measure, as a sort of compromise or alternative procedure to the more invasive forms by the American Academy of Pediatrics. But there was so much outrage in response to this suggestion with the thought that it appeared to be supporting female genital mutilation, and so this policy was retired or retracted just 1 month later. The next most invasive form is piercing. This is FGC or FGM type 4, one of a number of procedures falling under that typology. In Western countries, piercing, of course, is sometimes promoted as a form of cosmetic enhancement. So this is a random website. Do you want better orgasms more frequently? Does your man think a clit piercing is hot? Learn why people get it and how to do it right. There are hundreds of such sites and services available in Western countries. Technically, this fits the World Health Organization definition, which we'll come back to. Labiaplasty, or trimming or removal of part of the labia minora, is FGC type 2A. Again, this is clearly promoted as a cosmetic procedure in Western countries when it's done by a surgeon in a clinical setting. The thought is often that these sorts of procedures in the West are only done to consenting adult women for reasons that are conform to their own goals and values, whereas if they're done on minors or children, it would only be for medical emergency. But that's simply not the case. Sarah Crichton and her colleagues have shown that in the past 6 years, over 300 labiaplasties were performed in the UK on the NHS on girls aged 14 or under. The second part of the sentence here indicates that these are very unlikely that these were medically necessary, likely due to social or cosmetic considerations. Prepuce removal. Prepuce is, again, the foreskin, here referring to the clitoral foreskin. Again, a cosmetic procedure in the West, clitoral unhooding. One website touts it this way: in some women there is excess tissue that covers the clitoris. Sometimes the patient may be dissatisfied with this appearance. The procedure reduces the excess tissue in order to create a more attractive and youthful look, it is claimed, to the area, as well as more stimulation to the clitoris. So here it's actually touted again as a sexual enhancement. Now we've arrived at the least invasive form of male genital cutting. This is prepuce beyond removal beyond the glans. In other words, this is cutting off of the foreskin that extends beyond the head of the penis. This form actually is not performed anywhere very much these days. It has a long history. It was the original form of circumcision in Jewish ritual practice until about 150 AD, after the end of the Hellenistic period. The issue here is that Jewish athletes exercising in the nude with their Greek and Roman counterparts were embarrassed by having not the same amount of foreskin. They would stretch the remaining tissue out over the head of the penis to appear to be intact or uncircumcised. This, of course, poses the threat of assimilation, which is never a very positive thing from the perspective of the more conservative rabbis, and so they mandated what's called brit pariah, which is the stripping of the entire foreskin, or the removal of about a third or a half of the motile skin system of the penis. This makes it impossible to, as it were, restore the foreskin, and therefore removes the threat of physical assimilation. This particular, as it were, extreme form of circumcision is the form that was adopted in the United States in the late 1800s, partially as a measure against childhood masturbation. It's since become entrenched in the US medical culture and is a sort of quasi-medicalized cultural practice. One of the early promoters was John Harvey Kellogg, famously the inventor of cornflakes, who promoted infant male circumcision as a form of masturbation prevention. Incidentally, cornflakes were also promoted as a form of masturbation prevention. The idea is that they were easy to digest and they therefore would pass through the digestive system without too much extra stimulation when one was going to the bathroom. So he writes, a remedy which is almost always successful in small boys is circumcision. The operation should be performed without an anesthetic, as the pain attending the operation will have a salutary effect upon the mind, especially if it be connected with punishment. He had a recommendation for girls as well. Applying carbolic acid to the clitoris is an excellent means of allaying the abnormal excitement. So as I say, this is still a prevailing cultural norm in the United States, much less common, obviously, in most European countries outside of religious minority groups. Now, there are more invasive forms of genital cutting for both males and females. We could talk about those during the question section if you like, but I want to make this point. Types 4, 2A, and 1A of female genital mutilation are criminal offenses in the US, UK, and indeed most Western countries. They've been, as it were, banned by the United Nations. To pick one example of this, go back to pricking, the least invasive form. The first federal court case raised about genital mutilation in the United States involved the arrest of these two doctors from Detroit. They're members of the Dawoodi Bohra sect of Islam. They practice so-called ritual nicking, the mildest form of female genital mutilation. They regard it as a religious requirement, according to their local clerics, and they're facing several years of jail time if they are indeed convicted on this federal crime. By contrast, as I said, the more extreme form of male genital cutting is legal everywhere, with a partial exception in South Africa for boys under 16. Mostly unregulated. You don't need a medical license to perform a circumcision. There's a very different story here in terms of policy and law. Things get even more complicated when you introduce an intersex angle to this conversation. So here on the left side, these numbers are obviously a bit arbitrary. Modifications of the penis. Now I was going to say modifications of male genitalia, but now with increasing debates over the relationship between sexual anatomy and gender identity, obviously this is a difficult area to think clearly about. So I'll say modifications of the penis. Well, these are, as I say, legal everywhere, mostly unregulated. If you move over here, you have the criminal offense, banned in every Western country. In the middle, it's confused. It's mostly seen as legal to modify the genitals of intersex children when it's done for so-called cosmetic reasons rather than physical, functional, or medical reasons. There's debate about this. Some legal scholars argue that, in fact, it is not legal to authorize such genital alterations, but in any event, there's growing concern. I said the numbers there were a bit arbitrary. There's more of a spectrum going on here between clearly male and clearly female. And this raises the interesting issue, which is at what point along this spectrum does a small penis, which is legal to cut, become a large clitoris, which is illegal to cut? So the problem is that there's too much overlap, physically, socially, and symbolically. I haven't focused so much on the social and symbolic attributes. when the full range of practices across societies is taken into account and like cases are compared with like. So I suggest what's needed is a new ethical framework based on autonomy and capacity to consent, with a focus on children's interests or rights rather than, as I argue, unsustainable sex or gender-based distinctions. A dear friend and colleague of mine and I recently published a paper in a monograph collection for the European Parliament. This is Dr. Rebecca Steinfeld, Gender and Genital Cutting a New Paradigm. This is based on some earlier work of mine focusing on female genital alterations, male genital alterations, the comparisons and contrasts between them, and then adding an intersex element as well. So I encourage you to read that paper on your own time. All of these are available online at my academia page. So what's the unifying moral paradigm? You might say, well, all of these procedures, you could argue, violate a child's right to bodily integrity. You'd have to say what that means, and I'll explore that in a moment. You might say that they all are in some sense a form of sexual harm. Again, that's a complicated concept, and it requires some teasing apart. If it turns out that these are rights violations, what kind of right are we talking about? Where does this right come from? How do we know when it's been violated? Sometimes people speak of a legal or a conventional right, in which case, to determine whether a person has the right or whether it's been violated, you simply have to look up the relevant statute and try to interpret the language. Sometimes people speak about human rights as in a sort of metaphysical sense, that there's something that inheres in human beings, qua human beings. And other times you have discussion of maybe a moral right. Typically, the way this is described is it's an interest that's so important that it generates duties on the part of other people to honor those interests, and these can apply to children through to adults. Here's a Declaration of Sexual Rights from the World Association of Sexual Health. You'll see that they sort of have a mix of these different conceptions of rights. Sexual rights are grounded in universal human rights, so maybe that's the metaphysical sense or the moral sense, that are already recognized in international and regional human rights documents, that's a conventional sense, and national constitutions and laws, a legal sense. There's a passage in here on the right to autonomy and bodily integrity. It says, everyone has the right to control and decide freely on matters related to their sexuality and their body. Down here you see that this includes therapies, surgeries, or research. So with surgeries, it seems maybe we have some grounds here for objecting to these procedures on this mix of conventional, legal, moral, metaphysical human rights. The problem is that included in this definition of the right to bodily autonomy and bodily integrity is that one should be able to give free and informed consent. The problem is a lot of these procedures are carried out on minors, including infants, who cannot possibly consent to the procedures to which they are exposed. And this creates a problem. How would you protect children then? It can't be through the mechanism of informed consent. Infants at least cannot consent to anything, and even older children may not be able to give informed consent to at least certain permanent body alterations. Removing genital tissue before an age of sexual debut is clearly something that a person would not be able to give informed consent to because they don't understand what's at stake in that alteration. So do we need to conclude that in fact there is no right to bodily integrity for children, at least if it's based on this mechanism of consent? I wouldn't want to reach that conclusion too quickly, because a lack of an ability to consent on the part of a child does not, of course, provide a blank check to parents to modify their children's bodies just however they please. There clearly are some moral limits to how it is permissible to shape children's bodies, and so I suggest that we need to look at specific cases to infer the precise conditions for rights violation, if indeed this right exists. To do this, I'm going to be looking at the statement from the United Nations and the World Health Organization on eliminating female genital mutilation. This is from 2008. And we can look at a very influential account of a child's right to bodily integrity that is shaping global policy. So female genital mutilation is defined as all procedures involving partial or total removal of the external female genitalia or other injury to the female genital organs for non-medical reasons. Remember that other injury includes what we've described as ritual nicking, which does not remove any tissue and typically does not change the external morphology of the external genitalia of females. Also, labial stretching or elongation is sort of by fiat here defined as a mutilation, even though those who engage in this practice don't typically perceive it that way. So these procedures are claimed to violate the right to bodily integrity, and if carried out before an age of consent, children's rights. You put those together, you get children's rights to bodily integrity. Therefore, we can see that any alteration to the genitals of at least a female minor, no matter how slight, performed for any so-called non-medical reason, constitutes a violation of the female child's right to bodily integrity according to the World Health Organization and the United Nations. Now you might ask, does this apply to other parts of the body or only the genitals? Are other modifications of the body for non-medical reasons, tattooing, ritual scarification, and so on, would these constitute similar violations of a right to bodily integrity? You see that the term female is included in the definition of the violation here, so you might ask, what about other genders, intersex children or males? How plausible is this view? It's not plausible. It's inconsistent, hypocritical, and culturally biased. In the first place, female genital cosmetic surgeries, as they're perceived in Western countries, including those that are carried out on young girls 14 and younger, technically fit the definition of the World Health Organization, their definition of female genital mutilation, but the WHO has taken no stance and launched no campaigns to try to address these surgeries. They're focused instead on African procedures, typically. Routine ritual or religious male circumcision is given no attention whatsoever by the World Health Organization except for to promote it rather than to object to it. Medically unnecessary intersex normalization surgeries are ignored by the World Health Organization and the UN. Furthermore, if this notion were applied to other body parts and taken literally, it would rule out other interventions which are probably permissible. So an example would be cosmetic orthodontia. Braces clearly alter the body. If it's done for cosmetic reasons, it's by definition not for medical reasons. In other words, it's not required to help the person chew food or whatever. If you follow the reasoning through of the WHO UN, they should be opposed to cosmetic orthodontia. No one regards cosmetic orthodontia as impermissible. Cosmetic cleft lip surgery. Sometimes you have to repair a cleft lip to help with breastfeeding and so on, but other times it's more minor. In this case, again, you may be altering healthy tissue for non-medical reasons. There's some question here, but most people regard cosmetic cleft lip surgery, even if it's performed in the infant period, as permissible. Possibly removing moles or birthmarks may be permissible. Some would object to this. Ear piercing is a common practice that technically would fit this definition of a rights violation. Most people think this is okay. I've actually argued against ear piercing in other publications. I think people should be able to decide if they want their ears pierced when they understand what's at stake in it. Nevertheless, most people have relatively little problem with infant ear piercing. There's also other practices such as ear pinning. If the ears stick out quite a bit, sometimes parents will authorize a surgery to have the ears fit closer to the head. What do these interventions have in common? Well, they're all presumably sincere attempts on the part of the parents to enhance or improve the child's body and to increase the child's expected welfare, given the local, social, and other environmental considerations. No parent in any society thinks that they are mutilating their child when they authorize a body alteration for what we call non-medical reasons. For several of the cases we just looked at, presumably most people would agree that these are indeed not mutilations. A surgery for a cleft lip is not typically seen as mutilation, but again as a cosmetic enhancement or an improvement in some way. So what we can see from this is that it is clearly permissible to alter children's bodies for non-medical reasons before an age of legal consent. Age-appropriate consent should clearly be obtained where that's possible, and this applies to the case of cosmetic orthodontia, including in ways that are, for all intents and purposes, permanent. Some people point out to me that you could technically turn the teeth back to a crooked state or something like that, but essentially orthodontia are permanent. Ear piercing, sometimes the hole will close up, other times it doesn't. For the other interventions, they are permanent. Some of these alterations are clearly in the child's best interest. Others are clearly not. If you were to cut off a child's arm or a hand or something like that, no one would argue that that's in the child's best interest or an improvement to the child's body. And others fall somewhere in the middle. You could imagine a graph here with ranging from less contentious to more contentious childhood bodily alterations. A lot of this contention occurs in a cross-cultural context where you have individuals from one cultural background criticizing the practices of individuals from another cultural background. In this context, you have to remember that what we call FGM is called female circumcision in the local communities where it's practiced, at least when they're translated into English, and it's considered an enhancement. No parent thinks they're mutilating their daughter. Rather, they think that they're improving their daughter, and indeed most of these daughters grow up to regard themselves as improved. So in light of the local cultural norms, the vast majority of women in these cultures say that their vulva is more beautiful. They'll say it's cleaner and easier to keep clean. These are the very same sorts of statements you hear from men in the United States regarding their circumcised genitalia as well. So what's going on in these contentious cases? Well, I've raised the issue of different cultural norms. There might be different levels or types of knowledge concerning the alterations that affect people's judgments, different judgments about harm as well, including sexual harm. Male circumcision, I'm going to use this as an example of a physical outcome that could be construed as both a harm and a benefit. Of necessity, if you remove the penile foreskin, any sensitivity that would have been experienced in the excised tissue is, of course, of necessity precluded by the surgery. In addition, because the head of the penis, which is normally an internal organ, becomes an external organ when you remove its protective covering, it rubs against clothing, and in some men it can lead to further desensitization. So that might seem like decrease in sensitization means loss of pleasure means harm. Defenders of circumcision say no, a decrease in sensation means an aid against premature ejaculation, therefore it's a benefit. It might even be both over time. A young man and an old man might have very different views regarding sensitivity. There are clearly individual differences. Everyone's genitals are unique. When you're looking at an infant, you don't know what their sensory profile will be, and so you're taking a gamble when you make an early intervention. So it comes down to people's attitudes and preferences. The philosopher Scott Campbell argues that one of the components of risk is harm. Harm is not just a physical injury, but any sort of circumstance that P would prefer not to be the case, and this entails that our attitudes and preferences partly determine risk because our attitudes and preferences determine what counts as a harm. So we've just seen that people disagree not only about social or symbolic benefits and harms, but even what constitutes a physical injury when it comes to some bodily alterations. The implication is that we don't know if someone is harmed until we know their attitudes and preferences. Now, the problem here is that, as I say, many of these surgeries affect infants or small children. These will later become adults, whether male, female, or intersex. So we have to try to telegraph their interests in advance, which can be difficult to do, particularly in complex multicultural societies where people's views are changing all the time. The point here is that factors that shape people's attitudes and preferences are not stable, and there's a ton of individual variation. If you change your religion or your cultural affiliation, or you move somewhere else, or you gain a new perspective, your frame of reference, your basis for interpretation often also changes. So what you find happening is that people grew up feeling that their bodily alteration was an enhancement or just normal in their cultural environment. Then they get a change of perspective, and now they feel, actually, I think it's a diminishment or even a mutilation. This comes from this wonderful paper by Sarah Johnstotter and Brigitte Essen. They write, migration gives rise to cultural reflection. All the motives for female circumcision in Somalia are reconsidered in exiled life in Sweden. What was once largely seen as normal and natural about cut and sewn genitalia was questioned in Sweden, where the women were met with shocked reactions among healthcare providers. A thitherto strong conviction that circumcision of girls was required by religion was questioned when Somalis met Arab Muslims who do not circumcise their daughters. The fear that their daughters would be rejected at marriage if uncircumcised disappeared in the light of the immense Somali diaspora in the West, where Somali men can be expected to accept and even appreciate uncircumcised wives. In addition, the risk of stigmatization is decreased. Example 2, intersex, comes from this article here. I had never heard about this growing up. No one had ever talked about this, so that summer I went back home and talked to my mom about it. She remembered that the doctors had suggested a surgery in order to fix what they called a disorder. However, nothing was wrong with me. I have a natural variation of sex. They just used that language in order to fit me into imagined sex binary, thinking that it would be better for me. But actually, it has created a lot of harm for me and for many other people. A final example reported to Ronald Goldman regarding male circumcision. The shock and surprise of my life came when I was in junior high school and was in the showers after the gym. I wondered what was wrong with those penises that looked different than mine. I soon realized that I had a part of me removed. I felt incomplete and very frustrated when I realized I could never be like I was when I was born, intact. That frustration is with me to this day. Now, none of these people mention sort of surgical complications. In many cases, it's simply the sheer involuntary loss of healthy tissue or the loss of genital intactness that's felt as a harm, regardless of whether there are additional surgical complications associated with these surgeries. I said here, I've skipped other examples. There are countless illustrations of this principle. So here's my proposed solution to this dilemma. This comes from a paper with my colleagues on brain stimulation, but it applies equally to bodily changes. Adults are in a position to decide whether effect X is valuable enough to them to justify incurring loss or impairment Y. Children do not yet have the capacity or the life experience to make such trade-off decisions. They don't know what they will value when they grow up, and nor do their parents. So an intervention that improves X may count as an enhancement for the individual who does not care much about Y. Another individual who values Y over X will view the very same outcome as an impairment. In such cases, that is, cases in which the very status of an intervention's being an overall enhancement versus an impairment is controversial, the weight of consideration should shift toward delaying the intervention until the individual who will actually be affected by it has sufficient capacity to decide. The more permanent and substantial the trade-off, the more this argument has force. And here are the implications of this view. Medical interventions are just a special case of enhancement interventions generally, on a welfarist definition where you say that an enhancement is something that is expected to improve the person's life. Medical interventions just happen to be on the less contentious end of the spectrum because they're rooted in factors that are usually stable and not highly individually variant. So you can have a pretty good prediction that the person will indeed view it as an enhancement. So no one thinks open heart surgery is impermissible, even though it requires an extreme intrusion into the bodily sphere, and no child grows up to resent that they were subjected to this gross violation, as it were, of their bodily integrity. Similarly, there is no anti-orthodontic movement. The status of orthodontics as an enhancement is secure, whereas there are, of course, vocal anti-genital cutting movements for all genders for some of the reasons I've described. So there's nothing special about having medical versus non-medical reasons for altering a child's body before an age of consent. Those are proxies, I suggest, for the real issue. And this is my last slide. If a child's right to bodily integrity is going to do any work in this debate, it will need to be spelled out in such a way that it does not lead to absurd conclusions, such as the impermissibility of cosmetic braces, or inappropriately gendered or racialized conclusions. And on that regard, I'd be interested to hear any ideas that people have, and I thank you for your time.